Good afternoon. I have a pretty loud voice, but if you have any trouble hearing me, somebody wave or do something, but usually I actually tend to get louder as I talk because I tend to get more passionate as I go on. So if I start yelling too much, you can also wave and say, yeah, we can hear you plenty on the front row. So Governor, again, I want to thank you so much for hosting this opportunity, for inviting me to be part of it, and for us to continue our partnership. We're very grateful for the leadership of the Absentee Shawnee Tribe. Thank you. Absolutely. Dan, thank you. I know this has been a passion for you for many, many years. I've been very fortunate to know Dan for many years before he left Oklahoma, and then when we were lucky enough to get him back, and this is a great opportunity, and you all know what an amazing leader Dan is in this area. I'm going to talk to you a little bit this morning about generally mental health and substance abuse, particularly the addiction side of substance abuse, and specifically prescription drugs, and kind of lead up and set up for discussions that you all can have in the community. So I actually have a PowerPoint I'm going to talk from. Addiction is a disease of the brain, and this is where I start always, because I think it's most important that we end up on the exact same page. Addiction is a disease like any other disease. Very similar to the way diabetes is a disease of the pancreas, and I'm not a doctor, so don't worry, I'm not going to get real medical on you. But diabetes is a disease of the pancreas. It's where your pancreas doesn't secrete the right amount of insulin. Addiction and mental illness are diseases of the brain. It's just a different organ in the body, and I would actually argue the most important organ in the body. Our brain tells our heart when to beat, tells our lungs when to breathe, tells our pancreas when or when not to secrete insulin. Everything about our body is controlled by our brain, and the diseases that our brain develops, two of those diseases are mental illness and addiction. It is truly a chemical issue going on in the brain, just the same way diabetes is a chemical issue going on in the pancreas. And a lot of times when I have this discussion, people will say, I get that mental illness is a disease. They get that schizophrenia, for example, and how that might work, or depression. But a lot of times people still get hung up on the issue, but addiction, isn't that really a choice? People still get caught in that. And so I've stopped here to talk about that for just a minute, because I think it's really important that we understand this so that we can all work from that same page as we figure out solutions. The use of substances is absolutely a choice initially. It is absolutely a choice initially. And in Oklahoma, the average age at which that decision is made is 12 years old. The first drink for boys in Oklahoma is 11. The first drink for girls is 13 on average. So it's 12 years old. 12 years old on average that people are making that choice. But here's what happens for those of us that struggle with the issue of addiction. And again, I'm not a doctor, so I'm not going to get too scientific on you, but 1 in every 10 of our brains, if we were all sitting around a dinner table and I was serving wine because we were all over 21, 9 out of 10 of our brains would process that wine, that chemical in our brain, and we might feel some effects, but it would metabolize it just the way it's supposed to. But 1 out of every 10 brains sitting around that table would have a very different chemical reaction to ingesting that alcohol. And for 1 out of every 10 of us, our brain would begin to secrete a chemical that causes cravings for more alcohol. And as we continue to drink, not just that night, but over time, that chemical, that alcohol in our body, causes our brain to secrete a chemical for the 1 in 10 of us that craves alcohol, or more and more alcohol. And eventually what happens is a person moves from the choice stage and the abuse stage into the dependent stage, because that chemical reaction now is so strong in the brain. It's like the concept of being thirsty. It's like the concept of being thirsty and having water there but not being able to drink it. It truly is a chemical reaction that happens in the brain. The part that gets really complicated and really interesting, which is why I think this is such an exciting time to be in the area of brain science, is that while it's 1 in every 10 of us that has that chemical reaction, if you separate all of us that are the 1 in 10, not all of our brains react to the same chemical. I may have a brain that reacts to alcohol. You may have a brain that reacts, say, to opiates or prescription pain medication. Someone else may have a brain that reacts to methamphetamine, although most people's brain, because of the chemicals in there, do react to methamphetamine. There's not that many people that wouldn't react to that. And so it gets even more complicated, because it really is about a chemical process and a disease and an organ of the body not working correctly. And so when someone says, is substance abuse or addiction a choice, it isn't a choice. The initial use is a choice. But what happens in the brain after that truly is a chemical reaction. And I think sometimes that helps people to understand that we are talking about a disease in people who need medical care, not people who need to be looked at and told, just suck it up and just figure out how to deal with this issue. Because a lot of times that's what happens. This is a picture I love the most, because not only does it show that it's truly a chemical issue happening in the brain, but it shows that recovery happens in the brain, which I think is amazing. So the brain that is on your left, that's what you're looking at here is a picture of dopamine transporters. In the brain on the left, you see a dark blue outline, light blue in the middle, with lots of concentrated pink. That's what dopamine transporters are supposed to look like when they're working correctly. Look at the brain in the middle, though. The brain in the middle is someone who's been abusing methamphetamine. They've been clean and sober 1 month, but clearly the dopamine transporters in their brain still are not working the way they're supposed to. But this is the amazing part. Look at the brain 24 months into recovery, 2 years into recovery. Those dopamine transporters are returning more and more to normal functioning. This is truly happening in chemicals in the brain, and recovery happens in the same place, which I think is amazing. So one of the things as we talk about the issue of addiction that I stopped to talk about here is what is going on in Oklahoma. And we are going to spend a lot of time on prescription drugs today because it is the fastest growing area. But I do think it's important that while prescription drugs and methamphetamine tend to get a majority of the press and kind of tend to be the, if you will, the sexy topic right now that people want to talk about, one of the things we still need to remember is that alcohol is still absolutely the most abused substance in our state. It is absolutely the most abused substance. And in fact, when you look at our treatment system, meaning services that we fund throughout the state, the Department of Mental Health and Substance Abuse Services, when we fund treatment for thousands of Oklahomans each year, it's what we call the public system. To get into that system, people have usually probably been struggling with these diseases for a long time. People have lost the ability to pay any other way in order for us to pay for their services. That means they probably don't have insurance, they may not be employed. As you talk to people in our system, a lot of times they've lost their family, so they've been through a lot by the time they get to our system. 35% of them still identify alcohol as the issue that gets them. They're 1 out of every 3 people that we treat. It is the most common substance, if you will, that gets people into the situation that they're in, and is the chemical reaction that their brain is having. Marijuana tends to be the second most common, around 20%. Methamphetamine right around that at 20% as well. Prescription drugs at 14%, but let me tell you, when I started as commissioner, it was less than 10%. It is growing very, very quickly, and so I'm really glad we're going to focus on that today, and in a minute, towards the end of my presentation, I have quite a bit of information about that. For Native Americans receiving treatment funded by us, for those people who receive treatment funded by us and identify themselves as Native American, the drug of choice is very much the same. Alcohol is still the #1 issue, marijuana being second, then methamphetamine third, and prescription drugs. And prescription drugs, let's talk about that for a second. That includes opiates, benzodiazepines, barbiturates, other sedatives. A lot of times, the simplest way to think about it is painkillers. Prescription drugs being painkillers, identifies as #4. As a state, this is one of the most frightening things, I think, to me. We rank #1 in the nation for prescription drug abuse for every single age category. For anyone who's 12 years and older, we are #1, which means 12 to 17-year-olds, we have the highest rates of people abusing. 18 to 24-year-olds, we have the highest rates of any state. 24-year-olds to 44-year-olds, 25-year-olds to 44-year-olds, we have the highest rates. 45 to 64, and 65 and above. Every single age category, Oklahoma has more people per capita abusing prescription drugs than any other state. It identifies about 240,000 Oklahomans who are struggling with the issue of abusing painkillers, is what the CDC identifies. When you look at our general statistics of people who are abusing alcohol and illicit, meaning illegal drugs, it looks to be about 245,000 Oklahomans, and we know there's overlap between those two because a lot of times people don't just use prescription drugs or just use alcohol, they use both. But there are huge numbers of Oklahomans, and there are huge numbers of tribal members who are struggling with the issue of addiction, and specifically the issue of prescription pain medication. And even if it's not you, virtually no one in our state is untouched. We all have someone in our family, our friends, our coworkers, our tribal members. We all know somebody who's struggling with this issue. When you look at the issue of mental health and substance abuse, it's 1 in every 4 of us. So everyone is affected by these issues. And we know the consequences of them are devastating. I'm going to talk a little bit more about that in just a minute, but we know it leads to higher incarceration rates and the number of children entering the foster care system. Again, you see at the top the fact that we are the highest in all the categories for prescription pain medication. We have the 9th highest rates of deaths involving prescription pain medication. So that is a very, very scary thing. When you look at what happens as a result, a lot of times there's this myth that somehow because it's medicine, it's safer. Families believe that, parents believe that, kids believe that. They believe somehow the idea that they're stealing medicine, for example, out of a parent's medicine cabinet, that's much safer than buying a drug on the street or at school or something like that. It's absolutely not true. is absolutely not true because people don't know what their body reaction, if they aren't seeing a physician, may be to that type of medication. A lot of times we have kids who will mix medications together. Kids will get together, everybody brings something out of their medicine cabinet and kind of mix them together and take, a few of different kinds of medicine. They have no idea what those drug interactions are going to be between those medications. So the death is a very serious issue when you start talking about prescription pain medication. 1 in 12 people abuse painkillers. Again, just giving you some other names so you can be thinking about what these mean. Valium, Xanax, OxyContin, oxycodone, Lortab, hydrocodone. Those are examples, again, of painkillers and prescription medications. 22%, so that's almost 1 in every 4, certainly more than 1 in every 5, almost 1 in every 4 of our 12th graders has used prescription drugs without a doctor telling them to do so more than once in their lifetime. So more than 1 out of every 5, almost 1 out of every 4 of our 12th graders. Nearly 10% had done so within the past 30 days at the time that we did this study in 2010. In Oklahoma, prior to 2004, the death of American Indians, Native Americans from opioid pain relievers were too low to even be reliable. Unfortunately, from 2004, the death rate has increased 186%. For every 100,000 Native Americans, there were 7.3 deaths, and it's now up to 20.9, or 21 deaths for every 100,000 Native Americans. Among all races for the same period, the increase was 75%. So it is growing faster in the Native American population than it is growing in other populations. So that, I think this is a very timely issue that we are discussing here today. Nationally, in terms of prescription drug use, it's been on the rise for the past 20 years, but it has really taken off over the last 5 to 10 years. According to the CDC, the number of narcotic painkillers prescribed every year is enough to give every American a 1-month supply. Every American a 1-month supply. We have physicians who are writing a lot of prescriptions. You've probably heard of the concept of doctor shopping, where you have people who are getting multiple medications from multiple doctors. And there may be an opportunity for me to talk about this again a little bit later, but in case there's not, let me stop here for a second and say, the majority of our medical professionals are not doing something intentionally wrong. So I don't want you to walk away thinking that. However, I do think a significant number of our medical professionals do not understand this issue. It's not that they're doing something intentionally wrong, but they don't understand how dangerous and how addictive what they're prescribing may be. They don't fully appreciate or understand or potentially take the time to find out if there's the person that they are seeing already has a prescription from somewhere else. So we have an issue in the medical community of not maliciousness, but I do think that we do have an issue of maybe not full responsibility. And then also we have the small portion of physicians in our state, as does every state, who truly are using this as an opportunity for financial gain and may truly actually be doing this knowingly. But that's not the vast majority, but we still have an issue that most of our medical community, just because you're a physician or a nurse or involved in the medical community, doesn't mean you have any more knowledge about addiction than anybody else. While we think naturally that someone should, when you actually look at medical school curriculum, there's less than 2 hours throughout the entire process of medical school that's required to be on addiction. So it's not that people are walking out of medical school with a vast amount of training and knowledge necessarily around this issue. Just like the general population, some of us know a lot about addiction, either because we have family, because we've maybe experienced the disease ourselves, we've become interested, or we've worked in this area and learned about it. Just like when you look at teachers, most teachers, just like the general population, don't truly understand this issue. The same is true of our medical community, although that's beginning to change. We really are, as a state, stepping up our conversation around the issues of addiction, and people are beginning to understand them more and more. The Substance Abuse and Mental Health Services Administration and the CDC released a study that indicates for the first time that the abuse of painkillers and other medications is sending as many people to the emergency room as illegal drugs are sending to the emergency room. So people are showing up in the ER in medical crisis in need of help as a result of prescription pain medication. Among all races, the national death rate from opioid pain relievers from 1999 to 2009 was 3.4 per 100,000. If you remember, the Native American population was about 9.3 per 100,000, which is more than double. Again, what that means is we have higher rates of prescription painkiller abuse among the Native American population. And people in rural counties are nearly twice as likely to overdose on prescription pain medication as are people in the city. So when you also put together the concept of tribes and rural communities, it puts people at even higher risk. In terms of what we can do as a state, part of what I have to say, and Dan actually alluded to it during the introduction, which I do appreciate, because we want to be the best partner we can possibly be on this issue, but the last 4 years have been really difficult as a state. We have faced budget cuts every year for the last 4 years until this year. In fact, we've had about $36 million ripped out of the treatment system across the state over the last 4 years. We had a treatment system that already on any given day had 600 to 900 Oklahomans who actually made the step and asked for substance abuse treatment, who need residential, who qualify and medically need residential substance abuse treatment, and every single bed in the state is full. So if you can imagine being a parent, whether it's your child who needs help, whether it's your spouse who needs help, whether it's your brother, your sister, or a friend, and you call and they say, we'll put you on the waiting list and you'll be number 525. You can imagine that if people could stay clean and sober till we got to their number, they wouldn't need treatment in the first place, right? It's kind of counterintuitive to think, okay, well just hold on, you'll be number 700, we'll get to you. And by the time we get to their numbers, a lot of times we can't find the person. They're in the throes of their addiction again, and the window where they were willing to come to treatment is passed and they're no longer willing. Sometimes we've had worse things where people have become involved with the criminal justice system and now may be sitting in jail. Ultimately worse, they may have injured themselves, someone else, or paid the ultimate price and we've lost them. We've lost that opportunity and they are no longer living with us. So when you look at what's happened in the system, the reason that I bring this up is I think we have to be realistic about the resources that we have, and in hopes that we will kind of also realize how important this issue is, that maybe we will work together to ensure that resources flow to the state and to the tribes to address this issue, knowing how important it is for Oklahomans. There's still a huge gap in services. When you look at both our agency and the state Medicaid agency, this Medicaid paying for services for people who are indigent who qualify for Medicaid, when you look at both of them together, 70% of our adults who need treatment for mental illness can't get the help they need. About 78% of our adults can't get the help they need for substance abuse. So basically we're able to treat like 1 in 3. 1 in 3 is all we're able to treat. When you look at our youth and you look on the mental health side, we'd actually do better on the youth on the mental health side. I say only. Only 40% of our youth can't get mental health help, but that's still a huge number. But our biggest gap of everything is youth who need substance abuse treatment. 80% of our youth who need substance abuse treatment can't access that service in the state because there are not enough treatment providers and enough dollars flowing into the system to get people the help they need. That is huge. If we could address the issue of substance abuse among our youth, think of the years of suffering that could be avoided. Think of the years of suffering that could be avoided. The fact that they actually might finish high school, that they might finish college, that they've got a shot at having the job, a great job, a job that they want to have, the fact they may be able to raise a family if we're able to intervene early, but that's the biggest gap we have. Among the Native American population, in fiscal year 11, which is the fiscal year that we are was finished last year, we're just wrapping up fiscal year 12 right now, we don't have the data yet, but last year, for those persons receiving substance abuse services through the department, 2,780, about 15% of the people we served identified themselves as Native American. For the general population, according to the census data, and I know the census data is not complete, but that's what we have to go on, the census data says that the population of Native Americans is approximately 8.6%. So we're doing a better job at getting a higher percentage of Native Americans into treatment. You'd expect if it would just reflect the general population, about 8% of the people we would treat would be Native American, but actually about 15% of the people we treat identify themselves as being Native American. And if you look at our data from basically over the last several years, we've seen an increase of about 1,000 Native Americans per year receiving services. So last year it was 2,780, but if you look back just to fiscal year 2000, that year we only served 1,799. So we're doing a better job of getting more people of Native American population into services, but it's still not nearly enough. Including, if you include mental health services in there, we served more than 7,700 people with a tribal affiliation, and nearly 700 more than we had just 2 years ago. We try very hard to work collaboratively with our Native American population, both as treatment providers and prevention providers, and I'm going to give you some examples of that in a few minutes. Why does all this matter? And I'm sure in some ways I'm preaching to the choir. You wouldn't be here if you didn't already understand that this matters. But some of the things that happen, car accidents and other types of accidents and injuries, directly related to substance abuse and addiction. Broken relationships and marriages, absolutely related to substance abuse and addiction. Child neglect and sometimes abuse, absolutely related to substance abuse and addiction. Unemployment and lost jobs, addiction. Incarceration. If you look at the number of people who are sitting in our county jails and our prison system, we are spending a lot of our money. The majority of people who are there are struggling with the issue of addiction. Now, that doesn't mean that there aren't some people there who also did some really bad and scary things, and we might be able to agree that they should be in prison. But the largest number of people who are in prison today are nonviolent offenders who have a drug offense. The number one reasons, actually the top 5 reasons you can get into prison, if you look at the data year after year, it's possession, it's distribution, it's forgery, writing hot checks, most of which goes to support an addiction. When you look at the top number of offenses people are coming into prison for, it's not the things that we might all be able to agree on. Things like murder, rape, assault, where we're like, yeah, those people are very scary to us and to our family. It is drug offenses that are getting people into prison that we are spending far too much of our tax dollars on when we could be spending it on much less expensive, much more effective programs. School dropouts and lower education attainment. And really, if you look at all of the types of things we'd like to see different in our society, there's really 2 threads that seem to run through them. One I don't have the answer on, and that's poverty. Poverty is highly associated with negative outcomes, but the other is untreated mental illness and addiction. And if we could make a huge dent in that, we could begin to change around all those statistics we want to see different for our families, for our friends, for our communities, and for our state. The big question, of course, everyone wants to know is why? Why is prescription drug abuse becoming such a widespread problem? And it's difficult. If I had the answer, first of all, I probably wouldn't be sitting just right here. I'd be some national stage somewhere telling everybody the answer. But we know some of the factors. You all know some of the factors. And it's a combination of things. First of all, painkillers are more effective and legitimately help people and are being prescribed more now than they have in the past. We have a lot of people who are dealing with pain. I mean, truly, chronic pain is an issue in our society. People who have been very active in sports, people who have had injuries. There is a legitimate need for pain medication for many, many citizens. So you've got something that there's a legitimate need for and actually is legal, and then because it's available and there's easy access, you've got something that's basically ripe for exploitation and ripe for abuse. The wide availability is huge. I mean, if you think about, again, and we'll talk about this a little bit in solutions, how many people have pain medicine for some reason left in their medicine cabinet? I think about when I was in college, I went home to have my wisdom teeth out, and they gave me, I don't even know how many pills they gave me, but I only took them for 2 days when I was home that weekend, and then I left the prescription there. I went back to college. I never took it back with me. It is probably still sitting in my parents' medicine cabinet. If I went back there today, my guess is it's still sitting in my parents' medicine cabinet. People do not think about the fact that it's easy access, and so if you're a teenager or a young adult, or maybe even an adult, it's an easy access, easy thing to get a hold of. And there's accidental and intentional misuse of medications as well. Some folks who struggle with this issue truly legitimately had it prescribed to them and had a need, and were attempting to take it correctly. I'm sure all of us probably know, I know more than one person actually who was attempting to do it correctly but got addicted. A lot of times, for whatever reason in my life, it's people who've had back injuries, because those are really painful, and then they begin to struggle with the issue of addiction as they become addicted to the painkillers. And so it started out as a legitimate, honest, true need and turns into addiction. Then you have folks who truly didn't have a need for it, who are using it either because they were a kid who got it out of the parents' medicine cabinet, a spouse who got it out of the medicine cabinet, bought it on the street, wherever it came from, and intentional misuse. So it becomes a really complicated problem because you think actually, in some ways you'd want to say, well, let's just stop having prescription pain medication and that'll take care of that. But think about all the people who are in pain, right? So it's not really, I think we could all agree we should just stop, if we could, we just stop having methamphetamine, right? There's no legitimate use for having meth, right? We would just get rid of it. But with prescription pain medication, it becomes more complicated. So what can we do? As citizens, as leaders, as parents, we've got to become better informed about the effective pain management and the risks of abusing painkillers. We've got to make sure our medical community becomes more informed about what are alternatives to some of the most addictive pain medications, or if an addictive pain medication is necessary, how do you monitor for that? How do you talk to someone about the risks? How do you make sure that you do everything you can to help that person through without becoming addicted, and what to look for if they are addicted and what to do if that starts happening? We've also got to address it at the state level through prevention and education programs, treatment and legislation. When you look at our agency's budget, our budget previous to this year is about $300 million. About $300 million, which sounds like a lot of money. And it is a lot of money, but when you look at the needs, there's still a huge number of people not getting the help they need. When you look at our budget, out of that $300 million, only about $20 million of it is for prevention. We get almost no money for prevention, either at the state or federal level. The majority of our money is for treatment, which is after we've already had the problem. And that's not unique to our agency. That's what we do as society, is we deal with consequences instead of looking at preventing the problem in the first place. And so really focusing on prevention and education, I think, is really important. We've got to safeguard medications and keep them away from children and young people. Most addictions start in youth. Very rarely, although it happens sometimes, very rarely does someone come into a treatment center and say, yeah, my addiction started at 42. Right? That's not how it happens. When you talk to people who are in treatment for addiction, they can tell you stories of what they did when they were 15, what they did when they were 12, what they did when they were 17 or 19 or even sometimes 21. Very rarely, although with prescription pain medication, you can have that situation where someone's become injured and it really truly did start at 42, but most people's addiction starts young. And so safeguarding medications and helping people understand that appropriate disposal of medications is so critical to keep your child, the young adults in your home, your child's friends from getting their hands on it is critical. And again, prevention is the best solution. So I want to spend just a little bit of time to give you some examples of tribal partnerships that we have. Again, there's a lot, we have much more we could do, but we are trying very hard to be good partners with our sovereign nations and expand our partnerships. We're committed to establishing a collaborative relationship in Oklahoma. We have 17 regional prevention centers that serve the entire state. And those regional prevention centers are required to work with tribes in their respective regions on prevention services. In August of 2011, we were actually awarded a 4-year grant to address specifically the issue of prescription pain medication, alcohol, and other drugs. And those 17 centers have 23 counties that they've selected to be their focus at working in those areas. We have another initiative that's slightly different from substance abuse, although certainly substance abuse is often involved in suicide. We have a partnership with the Kiowa tribe around a suicide prevention partnership that has done some amazing things around their youth suicide rates. In 2010, we changed our prevention needs assessment tool. That every 2 years we do a prevention needs assessment with 6th, 8th, 10th, and 12th graders to get data about what's going on. And we included information on American Indian or Native American youth related to their behaviors as well as risk and protective factors, so that the next survey will separate data by tribal affiliation to provide customized information for tribes that would be even more helpful to them. So that's one of the things we thought would be helpful. It's hard to address a problem if you don't know specifically what's happening. We have numerous other projects, including a systems of care expansion that we're trying to work with tribes on to put more and more circles of care or systems of care out there for youth. We recently awarded Cherokee Nation a grant to provide prevention services. And our telehealth network has been incredibly, Dan was talking earlier about things that we can be proud of. We actually have the largest telehealth network or telemedicine network for behavioral health in the nation for a public health system, or public mental health system. We are further than any state on this. When other states look at this, they are sent to our state to see how we've done it. And we have absolutely from the beginning included Indian Health Services in that network. So that basically if any IHS clinician who believes a patient may be exhibiting signs of depression, anxiety, other mental health issues, they can immediately, via video, access a behavioral health clinician from a local community mental health center to determine if mental health services are warranted and get additional support or help if they need that. Several Oklahoma tribes are seeking to incorporate this technology into their service delivery system, and we're happy to help make that happen. We also recently hired, if you haven't met her, she's here today, Lucinda Myers. If you'll stand up for just a second, I know it's dark, but Lucinda is building and expanding our agency's partnership with tribal affiliation. She's our tribal liaison, and she's also overseeing the tribal state relations work group. So if you need anything, Lucinda is a fabulous contact for our tribes. In summary, as leaders within your respective communities, and obviously you're a leader if you're here today, you are the ones who can make things happen and bring about change. You absolutely are the ones who can make things happen and bring about change. The issue of prescription drugs is one that every community is facing, particularly our tribal communities, as you saw in some of the data. But it's important to know that it can absolutely be treated, and most importantly, it can be prevented if we decide to take on this issue. We've got to work together so that everyone has access to treatment and that we really change the face of our communities, but we can do this together. The Department of Mental Health and Substance Abuse Services stands ready to be here, to be your partner, to do everything we can to help make this happen, and I think this is a fabulous first step. So thank you very much for having me here today.